Hey everybody, welcome to the Sovereign Health Podcast. My name is Andy Schoonover, and we're on a mission to inspire radical personal responsibility for both the financial and physical aspects of your health. We get the joy of hosting thought leaders who are reimagining how healthcare is delivered. Hey everybody, we're excited to have Cori Zavada with us today. Cori, how are you?
I'm good. How are you doing?
Good. I'm excited because, the entire reason I started CrowdHealth is because I got ripped off by a hospital. And so I'm excited to have you on today because you are the expert. I don't know if there's anybody more expert in this country than you on how to help people like me and some of our CrowdHealth members and anybody else listening to this keep from getting ripped off by hospitals. So Cori is the founder of a bunch of companies. And full disclosure, Cori works with us at CrowdHealth to help our members reduce hospital bills and keep them from having procedures they shouldn't be having and things like that. So FRM is one of your companies, which is the one that helps us negotiate down these bills. And then Veza is another one, which helps us understand, like, hey, is this something that actually should be done? And having kind of a second opinion on that. And so I want to talk about both of those two companies, but so quick background, as I mentioned, and I've mentioned this on several podcasts, but I started CrowdHealth a couple of years ago because my little one had a recurring ear infections, had a hole in her eardrum, so went to the ear, nose, and throat doctor who told us that, yeah, just go to the hospital and get tubes in her ears. I was on a healthcare.gov plan at the time. And so we went and did that and got the bill, and it was, $8,000 for a 15-minute procedure. And I was just like, there is something wrong with our system. If they get $8,000 for 15 minutes, I joke, I'd love that hourly rate. And then I get the bill back from the health insurance plan and said it's medically unnecessary. So, I had to stroke an $8,000 check to the local hospital and didn't know that there were folks out there like you who could have probably helped me with that $8,000 bill to really fight the hospital system. So I'd love to just get your overview of what does FRM do, what does Veza do, and let's start there.
Yeah, so FRM is Fiduciary Risk Management, and we're a boutique consulting and legal firm that helps primarily self-funded health plans and entities like yourself and individual patients deal with medical expenses, excessive billing, and out of a need for my clients back in 2017, I started a company called VezaHealth. And it started out as purely a remote second opinion company where, I was struggling with the fact that, not only were we paying too much for healthcare, now we're paying too much for healthcare that some people don't even need. Mm-hmm. And so I had a client come to me and say, hey, will you help me find a remote second opinion company that I can bed into my self-funded health plan? And I went out and I vetted all the big shops, right? The Mayos and the Clevelands. And I went through their second opinion programs, and I walked away disappointed and realized that those programs were going to put the onus on the patient themselves. They were going to have to go do their own medical record acquisition. They were going to have to go find their own images, get them uploaded, and they were going to be left with an opinion from a physician within that particular organization. And so I went back to my client and said, here are your options. I don't think they are what you want. And if you give me a couple months, I'll put together a second opinion program. And it has morphed over the years into kind of a high-touch clinical concierge and navigation program where we are helping members across the country make sure that they have the proper diagnosis, the proper treatment plan, and to the extent that we can negotiate on the front end, everybody wins.
That's great. So it sounds like there's a couple components here. I'm sorry about that, Cori. It sounds like there's a couple components here. One is, are we actually getting the right clinical services that we need, right? And then the second component of that is, are we paying the right amount for those clinical services? Is that fair to say? And Veza is on that kind of that first half, and FRM is on that second half?
Yes, absolutely. And I'll give you a little backstory as to kind of how I ended up in this particular space. I'm an ERISA attorney by trade, but
Mm.
I'm unique in what I do and my expertise. But it was back in right around the time that the ACA came about. And I was chief operating officer and general counsel for a national TPA at the time. And I was back in DC doing some lobbying. And the ACA had just been enacted. And there were a group of us from the industry that were we had a meeting at the Consumer Union building, and we walked into this big, elaborate boardroom, big, huge marble table, 30 people sitting around it. And we're about to embark on a conversation with regard to the ACA. And at the time, I could have had many pros and cons about the ACA to discuss with you. But the meeting started out, and the individual that was kind of the spokesperson for the Consumer Union said, I'm just so glad that the ACA has this requirement that organizations send out SBCs. And SBC is a summary of benefits and coverage. And it's a mandatory, legally required document that we all get that's around 8 pages long. And it's meaningless. It gives us no information, but we have to send it out. And as soon as she said that, I thought to myself, I am not going to last long in this meeting. I'm going to get myself in trouble. I better excuse myself. And so I excused myself, said I was going to the restroom, and I went to the lobby. Well, lo and behold, the Consumer Union is tied to Consumer Reports. And so I'm standing in the lobby of the Consumer Union building while everybody else is having this meeting about this very important document that I think is garbage. And I'm looking at their walls, and their walls are covered floor to ceiling with Consumer Report magazines. And I thought to myself, I could stand here all day long, all day, and I could get cost and quality information on anything I want, anything, a coffee pot, a car, a washer and dryer, a vacuum, you name it. I could get as much information as I could possibly absorb on that tangible item. And then my next thought was, oh my God, healthcare is the most important purchase that we as consumers in this country make on a daily basis. And we do it like this. We've got blinders on. We don't have access to quality information. We don't have access to cost information. Somebody says you need to have something done or you need to go to this one place, and we just march without asking any questions. And then we get to the desk and we check in, and the majority of them, as you probably remember, there's a little black box with a stylus, and they're like, sign here. Yeah. And nobody asks what we're signing, right? And that's supposed to be a valid contract that we're going to pay these crazy prices. So it was just an aha moment for me, and kind of where I got on my transparency kick and started moving more into this advocacy role for patients across the country, because our current system, as you know, is fundamentally broken. And any way that we can help patients, we try and do that.
Yeah, it's one of those things where it feels like you have somebody coming and mowing your lawn, shows up afterwards and says, "Okay, that's going to be $1,500," and they just expect you to pay it. We wouldn't do that in our normal day. Yet we do that with healthcare almost every time. And in fact, if you ask somebody what a range of procedures cost, people would have no idea. Like, how much should a colonoscopy cost? How much should a primary care visit cost? People just don't know what these things cost. And it's one of the very few, I can't think of very many others, but we have no idea what we're paying for. And in fact, it's because we're not actually directly paying for it in a lot of those cases, right? Like, we have come to this behavioral just wiring where we want to flip down our insurance card and then don't worry about it until later. Yet that explanation of benefits or whatever comes in the mail, and it's, whatever it is, 5, 10, 15 pages. And you're like, what? Like, do I owe $5? Do I owe $500? Or do I owe $5,000? Like, I have no idea, and it's clear to me that the healthcare system has been built on a business to business relationship as opposed to a business to consumer relationship. Because if Apple sent you that, explanation of benefits, it would be very, very clear what we owed, because they are more of a direct to consumer type of company. And so, what can we do as consumers of healthcare, especially ones with CrowdHealth, where our CrowdHealth members are actually paying the bills. It's not somebody else paying the bill for them. Are there things that we can do either up front at the doctor's office or later to protect ourselves from getting price gouged, when we get that bill in the mail 6 or 10 weeks later?
Absolutely. So, we have done a poor job in this country, and it's not necessarily our fault. It just kind of happened to us, but we've done a poor job in creating healthcare consumers, right? So just like the individual buying the washer and dryer will go research ad nauseum on the cost and quality of certain brands, we haven't had access to that information to do from a healthcare standpoint, and we haven't really been taught how to do it.
Mm-hmm.
And the other thing that's important about what you just said is, insurance. I will tell you that over 60% of all United States health workers, all employed individuals in this country, over 60% of them are covered under self-funded health plans, majority of which are governed by ERISA. Some of them are governed by both state law and ERISA if they're a structure called a MIWA. But over 60% are self-funded health plans. A self-funded health plan is not insurance. It's a reimbursement mechanism, right?
Mm-hmm.
So my goal for my clients that are self-funded is to help them create good healthcare consumers, because they have to treat that money as if it's their own, because it is. And it's not an insurance policy that they just slap their card down and some big carrier is going to foot the bill. But as a healthcare consumer, if you're told that you need to have something done, first of all, there's the whole medical appropriateness approach, right? Do I really need to have this procedure done? I will tell you that since 2017, just in Veza alone, over 30% of the patients that we have had encounters with received an entirely different diagnosis after they got a second opinion. Over 30% of the people that we had a relationship with that were told that they needed to have a surgery did not have a surgery. It was determined that it was not medically appropriate. And again, over 30% of the people had had a change in their treatment plan once they came to Veza and had a second opinion. And so the first thing you need to do is to make sure you're heading down the right path. Do I have the right diagnosis? Do I have the right treatment plan that's being recommended? And if it's a surgery, do I truly need to have this surgery? Once it's determined that—
Cori, can I stop you there for 1 second? Because we are conditioned to just say, well, this is our doctor, right? Our doctor knows. Our doctor should know what we need, to get better. But what you're telling me is oftentimes more than 30%, it sounds like, the doctor is actually getting it wrong, right? And we're not conditioned to be like, oh, our doctor could be wrong, yet our doctor is wrong a lot of times. Like, help us understand that. Like, that's a crazy thing to even, comprehend.
Yeah, I don't know how to help us understand that, but it's scary.
Yeah,
and
it's scary.
It should be at the forefront of our mind whenever we're being told that we need to have something or that we've been, diagnosed with something. I had it happen within my own organization within the last month. I had an employee that had several ER visits that were cardiac related. She goes to the Mayo Clinic. The Mayo Clinic is a renowned, reputable. Everybody thinks that if they can get treated at Mayo, they're doing great. She was being treated at Mayo. She wasn't comfortable with what they were telling her. And I said, there's this little company that you work for called VezaHealth. Why don't we get you a second opinion? So we went to one of our electrocardiologists. She got a second opinion, and he came back to her and said, you need to have this one specific diagnostic image done. And she went back to Mayo to her treating physician and said, hey, I had a second opinion, and here's what he's telling me. And the physician at Mayo apologized to her, which that's a first. Usually they're very defensive in what they've done. He apologized to her, and then he has since done the test, and she's moving towards a path of recovery. But I don't understand why we have been conditioned to just like march forward blindly when it comes to healthcare. Like no questions asked. Right? I've been diagnosed with this. I need to have this surgery. And we just do it.
Do we
Um,
want to offload that responsibility onto the doctor? I mean, the name of our podcast is Sovereign Health, meaning we need to take more personal responsibility, more self-sovereignty over our healthcare, and not just outsource it to doctors who oftentimes, you just said 30%, and this is a
yeah,
Mayo. You just gave an example of a Mayo doctor. We think of Mayo as like the
yeah,
Harvard of, medical places to go. Like they have to know what's right and wrong with me. What we're hearing more and more is maybe they're wrong. Maybe we
yeah,
need to do a little bit more work to figure out, because nobody wants to get a surgery. Like that's
yeah,
not a fun thing to do.
yeah. Well, and if I give them any forgiveness, if you will, medicine's complicated, right?
Mhm.
And so, I kind of have come to this point in my life where I don't expect them to know everything. But I'm also certainly not going to take their word for it when it comes to a diagnosis or a treatment plan. And when it comes to anything major, and to me, major at this point is something as simple as a diagnosis with a prescription that's followed by it, right? I had a patient that was diagnosed with diabetes, was given a prescription for insulin and said, come back in a year. He had already had an encounter with VezaHealth and he knew better. So he came to us immediately. We got a second opinion. He doesn't have diabetes. And so, like, what could
Wow.
have happened to him taking medication for a year as a type 1 diabetic when it's not even an accurate statement? So I'm to that point where whatever's going on with you health related, you need to get a second opinion and verify the diagnosis and the treatment plan just so you're comfortable from an education standpoint as a consumer. Like, what's the harm in it, right? Like we need to
Mm-hmm.
know as much as we can know. Personally, I'm in this middle-aged swimming pool of hormones and thyroids. And I this morning I sent 31 lab results to 3 different doctors, right? And I'm waiting to see what's going to come back. And it's probably going to be roughly 3 different scenarios.
Mm-hmm.
And as a consumer, I'm obviously educating myself on all things thyroid and hormones, but we have to take the responsibility, and we can't just go forward without having our own personal knowledge and feeling like we're heading down a path that's medically appropriate.
Yeah. I'm wondering, and man, we could get down this rabbit hole pretty deep, but I'm wondering if health insurance and the doctors, every doctor I talk to hates health insurance. It feels like it's a little, thing sitting on their shoulder telling them what they can and can't do, what procedures they can and can't do. They are consistently jamming down rates. So primary care docs have to see 30 people or 40 people a day just to, pay the bills, and therefore don't have the capacity to actually learn everything. Studies are coming out every day. I mean, the last guest I had, they said something was like 200 or 300 new studies are coming out every single day on this kind of stuff. And so it's impossible for the doctor to be able to keep. And then they look at, the American Diabetes Association and the American College of Cardiology and the American Heart Association, who are all influenced by, very large organizations. And so I'm just wondering if, as I get to the why is this happening? Insurance has got to be a part of this, plus all these other economic interests that impact the decision-making processes of these docs.
Yeah. So I would say insurance is a piece and a part of it. The cynic in me would just kind of pull it all together and call it greed.
Mm.
So, the insurance companies that individuals and employers work with, and facilities, they have certain requirements. I know facilities are dealing with regulatory requirements too. Doctors are not able to practice medicine in the way that they intended when they are part of a large healthcare system, right? I just spoke at the Free Market Medical Association last week, and that room is filled with physicians across the country that have broken free from a traditional setting within an organization that's owned by a corporation, a hospital system, a conglomerate of providers that are also owned by a system. And their primary reason for doing so is so that they could practice medicine. Even the doctors that we have a relationship with through Veza are so excited when they get to have a second opinion with our patients, because it's usually at a time of the day where they're not seeing other patients. A lot of times it's after hours, sometimes it's on weekends. And the longest remote second opinion that we did was an hour and a half long. And the doctor actually emailed me thanking me for having the program that we have so that he feels like he can actually practice medicine. Because in a traditional setting, what's the national average? 7 minutes. You got 7 minutes to speak to the patient. The rest of it's filling out your paperwork to make sure you're satisfying government regulations and insurance requirements, and then you're off to your next person.
Yeah.
It's not feasible to practice good medicine, and I like relationship-based medicine, and that's impossible in that setting. Just literally impossible.
Well, so it sounds like the first step, if I'm a consumer of healthcare, a smart consumer of healthcare, what you just said there might be step number one, which is find a doctor who's not a part of the system and is not influenced by insurance and pharma and all these kinds of things. And so that to me sounds like it's somebody who's outside of a hospital system, who probably has their own practice, or also known as, loosely kind of an independent doctor. Start there, because they're going to be the ones that are going to give you the most probably unbiased opinion of what is actually going on. Is that a fair first step?
Absolutely. If you can find them, and granted, they're probably not all great, but if you can find an independent that has some, credibility, that's always your best option. And I think that's why these DPC, the direct primary care programs, have been, popping up all over the country to allow patients easier access to that primary care. And then kind of to follow that through, when you need things, when you need imaging, you're best to have it done outside of a facility. I mean, from a financial standpoint, you can get an MRI at a freestanding facility for hundreds of dollars, or you can get the same exact thing in a facility for thousands of dollars. I've seen a CAT scan in California, and a basic CAT scan in California, and my client got billed $27,000 for a basic CAT scan. Medicare would have paid $350 for that CAT scan. So,
wow.
I mean, I've got 9 claims on my desk right now, 9 individuals, 9 claims, totaling $86 million.
Wow. Well, and I think a cardiac calcium test, which is basically a CAT scan, if I'm understanding correctly, of your heart. If you pay that in cash, you can get it for under $100. And yet they have a CAT scan in California that you have to pay $27,000. And the difference probably between that and what, I got for under $100 is very, very small. I mean, the difference in that is my guess. That's crazy. So I've found an independent doc. I go to that doc's office. Are there things I can do at the doc's office to ensure that I'm not getting charged an egregious amount of money, at that doc's office?
Yeah. Well, chances are, if you're working with a primary care doc that has broken away from the system for the reasons that we're discussing today, my guess is it's going to be a fairly transparent relationship. But let's take it back to the majority of the patients that are going to the doctor today in a facility or a large system-owned provider's office. Like I mentioned earlier, you walk in, they get your intake information, and they have you sign your name on the little stylus, or they give you a stack of paperwork and have you sign their name. So I'll give you both scenarios. If they're asking you to sign your name on this with the stylus on the little black box, ask for the paperwork. Like, you have a right to know what you're signing. You have no idea what you're signing. I have no idea what you're signing, but I can guarantee you somewhere embedded in that system is something that says you're going to agree, you, the patient, are going to agree to pay whatever they bill you. And that is not reasonable. So ask for corresponding paperwork. I have even gone so far as to tell patients, if you're asked to sign your name on the little black box and you ask for the paperwork and they won't give it to you, instead of signing your name, write, she wouldn't give me the paperwork.
Yeah.
Why do you want your signature on a document that you don't even know what you're agreeing to? Because what that provider is going to call that signature is a contract. That's a whole nother legal analysis for us to go down. but you wouldn't ever sign a contract in any other scenario that you weren't able to read. If they hand you the paperwork to sign instead of your signature in the little black box, you have to actually read it, right? And if it says things that you're not comfortable with, you need to cross it out and initial it, write your own things in, but you shouldn't just be signing your name to documents, whether the documents are in front of you or they're hidden behind the little black box, that you have no idea what the terms and conditions are.
Yeah, and so I get a big sheet. I mean, it's probably 10 pages long or something like that. What of those sheets should I be looking at specifically? There's probably a financial responsibility form that's included in there. We've always told our people to, mark through the piece that says I'm fully responsible for whatever I'm billed, and basically put something in there and say, I will pay a reasonable cost for the services provided. And that gives you at least a little bit of negotiating room to say, okay, well, now we can at least negotiate what reasonable is. $27,000 for a CAT scan is not reasonable. And
absolutely,
you're an attorney. I know that you have attorneys working for you that can work on our behalf to say, hey, this is not reasonable for X, Y, and Z reasons. And using that from what we've experienced with you all, those hospitals or doctor's offices or whatever have come back and say, okay, we'll actually negotiate with you here.
Absolutely. To the extent that you can cross it out and insert your own language, it's best to do that. And I'm going to guess 8 times out of 10, whoever you're handing that paperwork back to is not even going to see that you modified the contract. And then we can argue about it on the back end. But nobody should be agreeing to be entirely responsible and pay full bill charges when they don't even know what bill charges are. Yeah. And kind of the other thing along those same lines, we're now in this world of, what everybody's calling transparency. We're falling behind. Not everybody's there, and they certainly don't want to be forced down this path. But you, as a patient, when you're going to a facility and prior to going to a facility, you need to ask. You need to ask what the charges are going to be. Now, unfortunately, the majority of the time they're going to tell you that they don't know and they can't tell you until they see you. But you need to ask, and you need to kind of document what transpired from the time you asked to the time you got your bill. Because there's many scenarios where, they said they couldn't give it to me. I asked again, they couldn't give it to me. And those kind of scenarios help us when we're defending a patient on the back end when they get billed something astronomical.
That's great. And then the only other thing I would say is, if you're in a doctor's office, always ask for the cash pay rate, because most of the times those doctor's offices do have those. The other issue that I feel like we have, the other scenario, is people who go to the ER. People go to the ER, they get some kind of healthcare service. And what we've been seeing, and I know that you've walked along this path with us, is hospitals basically say to these people before they leave, listen, your bill is insert incredibly egregious number, right? Let's just say $50,000. If you leave this hospital, we are going to charge you $50,000. Now, if you're willing to pay now, we will charge you $19,000, but you got to give us a $5,000, deposit or something like that. And we're seeing more and more of this. And so I think the question mark for people is, should we take the offer, or should we wait for the bills to come and let someone like you all negotiate them on our behalf?
Well, that's interesting. And that's actually a new one for me.
Oh, okay.
So thank you for bringing that up. And as you were laying that out for me, it dawned on me why they're doing it. So there are a handful of claims, and emergency room claims are one of them, that fall into this new bucket called NSA, the No Surprises Act. And there are certain rules that follow the No Surprises Act. And when a patient has an ER claim, and an amount is paid by their self-funded health plan or by their insurance company, if there is a dispute, that dispute lies with those two parties, the provider and the payer. And the law takes the member out of the dispute. It almost somewhat protects them.
Mm-hmm.
And so if this is happening, the reason is because these facilities, these ER facilities, don't want to get stuck in this IDR process under the NSA rules, because they're likely not going to get any more than the health plan or the insurance company paid on the claim initially. And there's going to be a significant balance bill. And until they go through the independent dispute resolution process outlined in the law, they can't go after the member.
Mm.
So my answer to that today is nobody should ever take the deal on an ER claim up front.
What if they're
Because chances
uninsured?
are, if they're uninsured,
Because
I still would.
CrowdHealth, all of our people are uninsured. I'm uninsured.
Yeah.
I've been uninsured for 3.5 years. And so I think what the hospital is trying to do in this case is saying, okay, you're uninsured. I know I'm going to get very little from you probably. And so if you pay me now, I'll take that deal. So you better take that deal. But what we've experienced is that if they don't take that deal and we give it to somebody like you all, and you're our kind of sole negotiating partner, you all can get a better deal with the hospital than what the hospital is giving them at the ER or whatever. We had an example literally 2 or 3 weeks ago. We had somebody who had a midwife in the home, pregnancy, the birth didn't go the way they wanted it to go, got transported to the hospital, had an emergency cesarean section. They told them this is a $50,000 bill and we will charge you $50,000 if you step outside of this hospital. Instead, will you pay $19,000? And the person said yes and put a big chunk of that on the credit card and say, I'll pay the rest out over a period of time. And so what we're trying to tell people is say, don't take the deal the hospital is giving them because it's not the best deal. The other thing about that too, and I don't know how this works legally, you're the attorney, maybe you can help me, but this person was, from my understanding, was eligible for federal or for financial assistance, but the hospital didn't give them the opportunity to fill out the financial assistance paperwork. They went straight to, here's a great deal, you need to take it. Right. And so all this whole story is to kind of like highlight the fact that it feels to me like hospitals are trying in every way possible to get as much money as possible out of these folks. And, that seems like a very manipulative, type of strategy. It's a crazy story, but it's a crazy story, but it happens over and over and over again.
Yeah, it's kind of scary. I guess my answer would be, I'd only take the deal if let's throw out a number. If it's less than $500, take the deal.
Yeah.
If it's anything over $500, don't take the deal. Right? Because chances are, an ER visit for a sprained toe or a broken toe or something, $500 seems reasonable, or whatever the case may be. Anything over that, it's worth analyzing. And you brought up the financial assistance thing, right? So many individuals, would satisfy a hospital's, it's called a 501R financial assistance policy. They're required by law to have these policies if they're a nonprofit hospital. If they're not paying taxes and they're a nonprofit hospital, they have to have FAPs. And many hospitals throughout the country fail to satisfy the regulations under 501R. I mean, they're supposed to do a handful of things with a patient. They're supposed to, provide them information on their financial assistance policy. And typically when we get involved and we start asking the questions, they haven't done what they're supposed to do legally. And so then, of course, I threaten them. Well, would you like to lose your nonprofit status? I mean, that's kind of what you've left me with. There's always an opportunity to negotiate there. And if you can go onto a website of any hospital and buried in it is going to be their FAP if they're a nonprofit. And you can see in their FAP how much of your bill should be written off. So, and it breaks it down by the federal poverty level, and the dollars are way higher than you would ever expect them to be. If you have a family of 3 and you're under this level from an annual income, the hospital has to write off 50% right off the top. Even if you can make that argument on your own, we can help you say, hey, Mr. Hospital, you didn't follow the rules. We want a deeper discount than that. So, we got to kind of hold their feet to the fire. And if we ever have a case where somebody had that situation where they were basically, coerced into, and my guess is they maybe had the patient sign something. And again, that's signing something without reading it. And you just signed a contract for the $19,000. That's wrong on many levels. And those people can come to me for help.
Okay. Well, you have that one. One of your people is working on that specific case for us right now. So we'll see how it goes.
Good.
But I think this person has some FAP, financial assistance plan eligibility. So it'll be interesting to see how this all goes down. The hospital, I'm assuming, is going to say, well, they agreed to it, and we're going to say, no, but you didn't give them an FAP option, and you're a nonprofit. It is a nonprofit hospital, and so it'll be interesting to see how this goes down. We'll keep the listeners posted on that one. Yeah,
absolutely. I will be inquiring within so that I can insert myself into that story.
Yeah. Well, some good stuff. One is, your doctor may not be right. Let's a second opinion is something that is super valuable. Nobody wants to go and do a surgery. It's going to cost you money. It's going to cost you time. It's going to cost you your health. I mean, nobody wants to be in a hospital anyway to go do a surgery. We know all, your friend, Dr. Marty McCary, points out the fact that, these hospitals have incredibly high, in hospital infections and things like that could have an adverse impact on our health. So you don't want to go in the hospital. So get a second opinion, find a doctor who is independent, fill out that paperwork and read it, draw through some things that you can't. If they give it to you only electronically, say she wouldn't give it to me, he or she wouldn't give it to me, in a paper form. And then if you have other procedures or labs or things like that, stay out of the hospital systems because they are way more expensive than any kind of independent, lab or imaging center or things like that. If you do get a big bill, give it to, somebody like you to help them walk through many options of negotiating that down. Financial assistance plan, even if you don't have a financial assistance plan or you're not eligible, there are still ways to negotiate that bill down for you, because most of these hospital pricing are just absolutely egregious. So we got lots of good stuff there. I'm just wondering, price transparency, you talked about it a little bit. There's a federal regulation that some hospitals are following and some aren't in terms of giving people access to these prices at these hospitals. How do you feel like that's going to play out? Is that something you think is valuable? Do you think it's just kind of, I don't know, something to make people feel good? Or, how do you feel like this price transparency game plays out?
Yeah, in theory, it's a good idea. I've been lobbying for price transparency at the federal and the state and certain state levels for a number of years. Their hospitals are obviously reluctant to do it because they have different prices depending upon who they're charging. So they don't want to throw too many prices out there. I think that nearly every facility in the country is probably falling behind from a regulatory standpoint as of today. I think that they will post the prices that are the low-hanging fruit. And I don't think we will ever get to a point, regulation or not, where you could call up and ask for price transparency on anything that is a high dollar claim. I think they're just going to continue to have excuses. We'd have to see the patient. They may have comorbidities. And yet, my dear friend, Dr. Keith Smith, who owns the Surgery Center of Oklahoma, has been posting the prices on his website for, I think, since 2009. And back in 2009, when I met Keith, you could get a knee surgery at his surgery center, which had a 0% infection rate at the time and probably has always had a 0% infection rate. You could get a knee replacement for $15,000 plus the cost of the implant. And I bet if we logged onto his website right now, it may have gone up $500 since 2009. When I was lobbying for transparency in the state of Montana 15 years ago, 12 years ago, I actually pulled claims data and found claims data just in the state of Montana for a basic knee replacement, the same one that Keith's doing for 15 plus the cost of the implant, and they range from $36,000 to $146,000.
Wow.
And so, to add to your list of to-dos, you need to ask what the price is.
Sure.
And if you can't get it, you need to document. People have to keep like little diaries. You have to document that I asked for. I spoke with Betty. I asked for it. She told me this. I spoke with Charlie. I asked for it. He told me this. So that when we get the bill and it's the $146,000 knee surgery, I can call the CEO of the hospital and say, hey, your employees were asked for this. By law, you're required to provide it, and you didn't, and we're not paying $146,000.
Yeah, it's a really good point, because these surgery centers, and I think led by Oklahoma Surgery Center, Dr. Keith Smith, are able to provide these services at a significantly lower cost than hospitals. Yep. And it's primarily for outpatient, but we're seeing more and more surgery centers do some inpatient work. But they are oftentimes, we have a scenario here in Austin where we had a woman who tore her ACL, went to a surgeon who was going to do the procedure at St. David's Hospital, which is the big hospital system here in Austin. And we found it could be done half of what St. David's could do it for at a surgery center that was like 2 miles down the road. And so, if you can do some of these procedures at a surgery center, the infection rates are lower, the costs are lower. You're getting the same anesthesiologist, you're getting the same doctor, you're getting the same implant if you need it, but it's at a place that feels a little bit more like, a Ritz-Carlton in many cases. Like, you walk into some of these places and you're like, oh, wow, like this is a direct-to-consumer type of experience, as opposed to a factory, which oftentimes a hospital feels like. So let's add that. I love that. Add that to our list of like, hey, there are places where you can get these procedures for, significantly less. Ask what the price is.
Absolutely. Absolutely. You would do it for anything else.
You do, yeah.
The analogy that I like to use, I have a lot of car dealerships that are clients of mine. And it's kind of like going to a car lot and you're looking for a Lincoln Navigator, and you pick one out and you sign on the black box with the stylus, and then 3 to 6 months later you get the bill, and that's the first time that you're finding out what the cost of that Lincoln Navigator is. We would not in a million years purchase an automobile like that.
Yeah.
But yet that's how we do it, and we're kind of forced to, but we're forced to because we allow it to happen to us.
Totally.
Well, we're not pushing back.
Yeah, we got a system, right? Even within the self-funded space, which I know you work in a lot. Self-funded, for those out there, is you join an organization, a corporation. The corporation is the one that is paying for your health bills. They take the risk of that, as opposed to the health insurance plan having a risk. You may think you have Blue Cross Blue Shield of Texas, but they're actually the ones that are just administrating it for your big corporations. Your corporation is actually paying for the bill. And so that, even in that structure, though, if I'm the one that's consuming the healthcare, but I'm not the one actually paying for the healthcare directly. Indirectly, I am, because the company has less money to pay me in my paycheck, but I'm not directly paying for it. Whereas the lawn care example, the Lincoln Navigator example, all of those, I'm directly paying it out of my pocket. And so one of the things that we're trying to do at Crowd is build this system where you're actually paying for it out of your pocket. And then you have to go back to the community and say, hey, will you please help me pay for this? I was a good shopper. I actually went and tried to get good prices. I let Cori negotiate it for me. And so we're adding some of those components to have it be a little bit more of a direct relationship between the service provider and the person who's consuming that. And I think those market forces hopefully will have a deflationary impact on healthcare. But it's, you've got to take personal responsibility for that bill. And that gives you the incentive to actually do the work required to negotiate that bill down. Because again, we love just plopping down the health insurance card and have somebody else pay for it.
Yeah. The irony in that is the majority of the people, that 60% of US workers that I mentioned at the beginning that are in a self-funded health plan, it is their money. But we have done such a poor job from an industry educating those individuals to be healthcare consumers, because if they're going to go get $146,000 surgery, it's coming out of that self-funded health plan, as opposed to getting the $15,000 surgery that's coming out of the self-funded health plan. If a self-funded health plan folds up today and there's $100,000 left in the bucket, that money belongs to the plan participants. But they think of it as insurance and they don't think of it as their money. And employers, I gave this speech earlier this week, employers, healthcare is within the top 5 of their expenses, and they spend the least amount of time in managing that expense.
Yeah, well, that's so true. And a lot of these companies, I feel like they want to focus on their software, or they're selling cars, or whatever they do, their core competency, right? And they like, oh, healthcare, I don't know how to do that, and so it's very easy for them, even though their expenses, I don't know what the number was this year, but it was something like 15 or 20% or something crazy, and I think there's the forecast for next year is going to be even worse. They don't want to think about that yet. It's the top 5 largest expense line items, and it's the one that's growing the fastest, right? And so it's like, folks, if you're a company and you're self-funded, you've got to help. You've got to help being the one that puts pressure on some of these prices and really pay attention to it. You would think there was an economic motive there, but they just all feel like it's too complex. I don't understand it. There's nothing I can do about it. I personally believe that we should kind of bifurcate employment from healthcare. That's my personal preference, because I don't think our employer should be involved in our healthcare, but it is not, regulatorily, legislatively, doable right now. But my grand vision for the future would be, we all get healthcare on our own and our corporations would butt out. But that's my personal, moral kind of statement there. So good. Well, I mean, this has been, I think people who listen to this will feel way better equipped, as someone who's actually, a consumer of healthcare and a buyer of healthcare, to be able to go out, doing this a lot better. And we're just thank you for everything that you do. If you're a member of CrowdHealth and you have submitted a bill for crowdfunding, FRM or Veza has probably been engaged in some way to help us navigate that. So we're just so thankful for what you do and the kind of the passion that you have for, helping folks navigate this crazy complex system. So thank you for your time. Thank you for joining us. And, I'm fired up about, working with you and your team going forward. So thanks again for all you guys do.
Absolutely. Do we have a few minutes for a public service announcement?
Yeah, absolutely. And I also would love if there are places where our listeners can find you. What is the best place to find you all?
Sure. I'll give you that information at the end. But I wanted to kind of along our conversation of medical appropriateness. And this is, confirming diagnosis and staying on top of everything and finding the right provider. And so this is a kind of a PSA for all the men that are listening to this podcast. So as a male, you should be getting your annual exams. And as part of your annual exam, you're getting a PSA test. And that is one of the tools that are primarily used to help determine if you are kind of getting into the prostate cancer zone, if you will, right? And for years, they also would do a digital rectal exam, a DRE, as part of an annual exam. Prostate cancer is the number 1 cancer for men. It's usually silent. And without those 2 tools, you would never know that you have it, right? A few years ago, the U.S. Preventative Task Force came out and said that they no longer recommend DREs because one of the reasons, and I quote, the psychological harm in a false positive is too harming for a male. And so they took the DRE off of the list of tools to help patients determine if they have prostate cancer. And so many doctors across the country stopped doing them. And the American Cancer Society still recommends that they be done. And any, what I say, prominent or reputable doctor is still doing them. So a personal story: in December, my stepfather, who's been my dad for 38 years, came to me and said, I've been having my annual exams. My doctor did a DRE and he feels a mass, and I need to go have a certain image done. He lives in Montana. This is December. He couldn't get in for the specific image until March. Well, anybody calls me, including a family member, and they've been told that they possibly have cancer, I'm not going to have them wait for 3 months to get the image done, right? So Veza did its thing. We found a facility, an independent facility in Cody, Wyoming. My father drove 2 hours one day to go get this exam done. And because it was ordered by Veza or set up by Veza, I got the results back right away. And my stepfather has been diagnosed with stage 4 prostate cancer that already has metastasized to his ischium bone, and basically a 23% chance of living more than 5 years because his physician decided that he no longer liked doing digital rectal exams, and he just went by the PSA. And my stepdad's PSAs were within the normal range for the last several years. And it's not something that you talk about really around, a coffee table visiting with your family. And so kind of a PSA for all the men listening: if your doctor has stopped doing that, you need to either find a new doctor or you need to force your doctor to do it. Because my stepdad's only 69 years old and basically is living on a extended warranty at this point because of that doctor.
Sorry. I have to ask, given our conversation, how much does a digital rectal exam cost ish? Do you know how much that costs if I were to pay in cash?
I don't know. You're going to prompt me to go find out because it can't be that much. There's nothing involved in it other than a doctor and his hand, right? There's no test. There's no nothing. It's a digital rectal exam. There's nothing to do other than to feel whether or not there is a mass in your patient's body.
Yeah.
But I will. I'm going to find that out because it's an interesting question. And I think my father would have paid tenfold to have it done rather than to be at this point with a diagnosis that has caused way more psychological harm than a false positive would have had that been the case. So
yeah, thank you for that story. And it does bring up the fact that what we're hearing in healthcare today is that all of these tests, whether it be a digital rectal exam or it be a lipid test or a metabolic panel or whatever, that these are wastes. These are wasted dollars being spent because the probability of something happens is so small and things like that. What I'm saying is, let me decide as a patient whether I want to pay for this. I get a full set of labs twice a year. They're $44. You couldn't do that with health insurance because the health insurance pays $700 for the same set of labs. And so at $700, that's a waste. At $44, it's like, why wouldn't I do this? And so that's one where I would say, like, you paying in cash actually helps you get better healthcare because you can get prices that are way better than health plans, and you don't have to get a health plan's thumbs up. I'm 44. I got a colonoscopy because I thought it was the right thing to do. I paid for it. And, my health plan wouldn't pay for it. But look, if you have a colonoscopy and you have colon cancer, the probability of you living is very, very low. I mean, the colonoscopy is one of those that's going to take you out more than likely. And I'm willing to pay the $800 or whatever every 3 years to do that. And so I think there's a beauty here of paying in cash where you can get whatever services you want. You don't have to get the health insurance plan to give you the thumbs up. And, if you want a digital rectal exam, you just gave us a perfect example of saying, even if it costs an extra $30 or whatever to do that, it's worth it. It's worth it.
Absolutely. Yeah. Anything you can do to be proactive from a health standpoint is going to be far less expensive than treating the condition once it arrives.
Yeah. Let's just say that digital rectal exam is $30 and it is a 1 in 100 shot of you finding something. Even if it's a 1 in 1,000 shot, right? your expected value of that. So, 1 out of 100, if you do it 100 times, even if it's a 1 in 1,000 shot, let's do that. That's $30,000 worth of expenses that you would incur doing it 1,000 times. Now, how much is your dad or your father-in-law, stepfather-in-law, I'm sorry, I forget exactly what the relation is. Well, how much would he have paid to know that was, that would have occurred 3 or 4 years ago, right? Or whenever it was when they first be able to do it. I would have paid way more than $30,000 to live for more than 5 years, right? Like that is absolutely worth the expense of doing those things. And you, as a sovereign individual, should be able to make the decision for yourself, not a health plan, whether you want that done, because you end up paying for it. That's my perspective.
He should have been given the choice.
He should have been given the choice.
Yeah. And to answer your question, at $31.77.
That was close at $30. Yeah. Well, thank you for the story. Again, thank you for the time. Thanks for all you do. Knowing you and your organizations, your why for doing this is clearly to improve our system and to help people. And so that's why we love being affiliated with you and your team. My team loves your team. So just a good group of people. So thanks again for taking the time to hang out.
Absolutely. We feel the same, and we love working with you guys, and let's do this again. And I'll undoubtedly have more stories to share.
I can't wait. Thanks so much.
Thank you so much, Andy.